everyone, welcome to another video. In today's video we'll be looking at thyroiditis or thyroiditis. Thyroiditis refers to inflammation of the thyroid gland, and the thyroid gland is basically a small butterfly shaped gland located in the front of the neck. So the thyroid gland produces hormones that control the body's metabolism, energy levels, temperature regulation, and other vital functions. So when the thyroid becomes inflamed, it can either release too many hormones causing temporary overactivity, or not enough hormones causing underactivity. So over time, this inflammation can lead to permanent damage or thyroid dysfunction. So there are several types of thyroiditis, and they differ based on their cause, their duration, and effect on the thyroid function. So the most common types, we have Hashimoto's thyroiditis, which is an autoimmune condition where the body attacks its own thyroid tissue. Then we have subacute thyroiditis, which is a painful thyroid inflammation often triggered by viral infection. Then we have silent or painless thyroiditis, which is similar to Hashimoto's thyroiditis, but it comes without pain, hence why it's called painless thyroiditis. Then we have postpartum thyroiditis, which occurs after childbirth. Then infectious or acute thyroiditis, which is caused by bacterial infection. Then drug-induced thyroiditis, which is due to certain medications like amiodarone or interferon. Then for the causes of this thyroiditis and the risk factors. So thyroiditis may be triggered by autoimmune conditions, especially in Hashimoto's thyroiditis. It may be triggered by viral or bacterial infections, medications like amiodarone, lithium, immune therapies, radiation therapy or thyroid surgery, pregnancy, and during the postpartum period too can trigger thyroiditis. Then genetic predisposition. Then the risk is usually higher in women, and it's higher in people with a family history of thyroid disease, and also patients with autoimmune diseases like patients that have type 1 diabetes or lupus. So for the anatomy, basically looking at the thyroid gland is located at the base of the neck, below the Adam's apple. So it produces thyroxine, also called T4, and triiodothyronine, also called T3. And these hormones, they regulate the metabolic rate. So the thyroid gland is controlled by the thyroid stimulating hormone, which is secreted by the pituitary gland in the brain. And when the thyroid gland is inflamed, the thyroid may leak stored hormones into the blood, causing temporary overactivity known as hyperthyroidism. So later it may become underactive hypothyroidism due to damage and hormone depletion. So for the symptoms may vary depending on the type of thyroiditis and whether the thyroid is overactive, underactive, or normal. So if the thyroid is overactive, that is hyperthyroid phase, that's what they call it. So there will be rapid heartbeats, anxiety or nervousness, heat intolerance, sweating, weight loss, tremors, and insomnia. Then if the thyroid is underactive, that is hypothyroid phase, there will be fatigue, cold intolerance, weight gain, dry skin, constipation, depression, slow heart rate. So basically the opposite of the hyperthyroid phase. Then there will also be puffy face or hoarseness of the voice. Then if there is an inflammation of the thyroid gland, there will be pain or tenderness in the neck, swelling at the front of the neck, and difficulty swallowing. So in some types, like for example silent or postpartum thyroiditis, there may be no pain. So silent thyroiditis is also known as painless thyroiditis. So there may be no pain and symptoms may go unnoticed. So for the diagnosis is made using a combination of medical history and symptoms. like based on when it started, the duration, how the pain is, like is there pain, is there no pain, family history, recent illness. Then physical examination too, like feeling the thyroid for any signs of swelling, any signs of tenderness or nodules. Then blood tests. So thyroid stimulating hormones in blood test, it may be high or low depending on the thyroiditis. Then thyroxine, which is T4, and thiodothyronine, which is T3, sorry. So these levels can be checked using the blood test. Then thyroid antibodies can be checked to detect the autoimmune thyroiditis. Then erythrocyte sedimentation rates, ESR, can be checked to show for elevated levels. So this ESR, it can be elevated in painful thyroiditis or subacute thyroiditis. Then ultrasound can be done, ultrasound of the thyroid, to assess the size, the structure, and the inflammation. Then radioactive iodine uptake test can be done to check how much iodine in the thyroid absorbs, and is used in this case. The iodine absorbed is usually reduced in cases of thyroiditis. So for the treatments, the treatment depends on the type and severity of the thyroiditis. So for example, when we have Hashimoto's thyroiditis, which is caused by which is an autoimmune condition, so it often leads to permanent underactivity. So it's usually treated with thyroid hormone replacement therapy, usually with levothyroxine. Then when we have subacute thyroiditis, which is caused by a viral infection and is painful. So this thyroiditis is self-limiting, and it can last weeks to months, and is usually treated with anti-inflammatory drugs like ibuprofen, or steroids like prednisone for pain and swelling. Then beta blockers like propranolol, they may help with palpitations during overactive phase, like when somebody's having like fast heartbeat and all those things. Then for silent or postpartum thyroiditis, is usually temporary and is treated symptomatically by using beta blockers for hyperthyroid phase, levothyroxine for underactive phase if is needed. Then infectious thyroiditis is treated with antibiotics because caused by bacterial infection. It may require surgical drainage if abscess forms. Then we have drug-induced thyroiditis, which may resolve if the offending drug is stopped. So once you just stop the drug, it may resolve the whole issue, and it's treated based on symptoms and based on lab results. So for the management and the follow-up, long-term management is important to monitor the thyroid hormone levels and adjust the treatment if it's needed. So it's good for the person to go for regular tests like thyroid stimulating hormones, to check for these thyroid stimulating hormones, check for the T3 level, the T4 level. Then we have to educate the patient too on how to recognize symptoms of thyroid imbalance. So any whether it's a doctor, whether it's not, any healthcare provider that is in charge of this patient has to educate them on how to detect that they are having symptoms of thyroid imbalance. Then we have to monitor for progression to permanent hypothyroidism, especially in cases of Hashimoto's thyroiditis or postpartum cases. Then emotional support too is very important, especially for postpartum patients who may be experiencing a lot of mood swings and mood changes. So in summary, thyroiditis is a group of conditions involving the inflammation of the thyroid gland, and it can be painful or painless, temporary or permanent, and it may cause overactivity or underactivity of the gland. And causes range from autoimmune disease to infections to medications or postpartum changes, and management depends on the type, but it's may include anti-inflammatory drugs, hormone replacement, or antibiotics when it comes to infectious thyroiditis. So that is it for this video. Thank you for watching. I'll see you in the next video. Bye.